Good afternoon, this is Dr. Doe again. This video is quarantine special edition video number 25. Today I just like to talk something very common, or everybody has to go through this process, just sooner or later, or younger or older. It's called degenerative changes of our body. In other words, I'm not saying it's aging, but equivalent to aging, but just sometimes even earlier than aging, but just the nature cause called degenerative change. It could happen from head to toe, from the brain, from the eyes, from the ears, and the heart, the lung, and also the joint, the muscles. So this is the nature cause. Nobody will have exceptions. Just like I said, earlier or later, or younger or older. So let's start from the eyes. We talk from head to toe. We talk about the brain first. For example, the Alzheimer's disease, memory loss. This is the degenerative change. However, it could happen to everybody. Just some people has the predisposing factors genetically, running family, or there's some other causative. So some people develop Alzheimer early. Some people may never develop. It's not because I think just because they probably not live long enough. If they live long enough, they probably have it. Which means this is the natural cause. Of course, there's some predisposing factors. And the other degenerative disease I talked, like the eyes, like the cataract, or the AMD, which is age-related macular degeneration. The cataract is again, these are all the degenerative changes. Some people may have it, some people may not. It doesn't mean those people are not going to have it. It's just the process. Probably they develop late. Some people develop early and detect early and treated, caught. That means caught. So then treated. That's another two degenerative change. And also the hearing loss is also related to the age and degenerative change. So these are the cause, normal cause, and everybody will have it. If they live long, even though they were not diagnosed have this problem. These are, if they live long enough, they might have it. Some people probably 150 years old can develop, but they never live to 150 years old. But this is just the nature process of degenerative. The other one is like, for example, the joint degenerative change, the spine, the knee, the hip. Again, there's predisposing factors like a lot of activities and previous injuries, and also the long-term exposure to the coldness. So these are the risk factors will promote the early age, develop this kind of degenerative change. So I talk about that, and also talk about the preventive, how to delay this degenerative change. That's the purpose for today's talk. Everybody goes through this process, some early, some late, some young, some old. And talk about the elderly. I think the age definition, I'm not going to involve that part, because like I said, 50 years old probably have this or that degenerative changes. 80 or 90 years old, nothing happens. So this is related to the degenerations related to the age. However, it's not. It's individualized. I put that way. Different people has different process. So how to prevent it, to delay this degeneration change, that's the key. Lifestyle, I think you know it, to just keep rest a while, exercise, eating healthy diet, and maintain normal body weight. For example, the eye, how to prevent the AMD or cataract, the fish oil, that's one thing already proved, delay this process, and vitamin C, vitamin E has been proved to be effective to delay this age-related macular degeneration. For the hearing, also do not expose to loud sound, like the music too loud and long-term exposed. That will just promote the degeneration of the hearing. So that's another risk factor, and to prevent it, just limited loudness and long-term exposure to the noise. So this is for the joint, of course. Sports, if you do the sports, make sure you have the protection equipment. Make sure you do the warm-ups. Make sure you maintain the normal calcium, normal nutrition, etc. And also not exposed to the coldness prolonged exposure to the coldness. I'm not talking about you walking from the parking lot to the office. I'm talking about the prolonged exposure in the coldness. If that's the case, then you need to make sure to wear the proper protective equipment so that prevent that. So this is the memory. That's the last most challenging topic, how to prevent memory loss. Again, start from young. It has been shown that if you use your brain frequently, that process actually delayed the Alzheimer or delayed the memory loss. So just keep brain active one way or another, and also some stimulates which can damage the brain. Make sure, and different people has different response. So just make sure and eating healthy, sleeping well. That's the sleeping habits and the sleeping well is really effective to prevent. And also, of course, the fundamental lifestyle, exercise, and no overweight, etc. These are all the possible factors to delay memory loss. In terms of confirmed what kind of medication or what kind of measures can prevent the memory loss, I couldn't find any confirmed study. Probably you can search more, but these are just the generalized delay if happy lifestyle, healthy lifestyle, exercise, losing weight, and sleeping well. And these are the generalized factors which will delay degenerative change in many ways. So that's just briefly. In terms of how to delay the memory loss, different people might have it, different people may not have it. I will search more information on this. Hopefully I can find it, and I will post it on the comment section. But however, if you know it, the confirmed measures prevent memory loss, please. And there's some over-the-counter medications, but that's what I mean. I did not find research studies on those medications or whether, but it has been shown to have the effect. If that's the case, then take some over-counter medications to improve the memories. So in another word, to delay the memory loss. So this is about the degeneration of our body, degenerative change. I said it's a physiologically degeneration, but sometimes it's pathologically. Depends on the age and the symptoms, how severe they are, and of course the causative reasons. So this is the degenerative change for the body. I hope it helps, and thank you for watching. I'll see you next time.